Hey everyone, welcome back to Unlearn with Bianca. If you're new here, welcome. On this podcast, we explore everything self-healing, health, personal growth, the mind-body connection, relationships, and more. So today we are talking about pain, a mind-body approach to pain. I'm very lucky to be speaking with Rachel Gofman. She is a doctor of physical therapy, a pelvic pain coach, and Rachel's mission is to help women liberate themselves from a life consumed by chronic pelvic pain and help them create lives of purpose, connection, and intention as they heal through a mind-body approach. So welcome, Rachel.
Thank you. I'm so happy to be here. Thanks so much for inviting me.
No worries. We're very aligned. So before I get in, I just want to share a bit of context as to why I was really keen to have Rachel on this podcast. So when I first came across her story, it almost felt like I was reading my own. It's pretty amazing when we can really connect to somebody else. And by sharing our stories, that's how we really connect. So that was the first point. And although there might have been some slight differences in the way that we actually moved through healing and shifting pain, Rachel still did use a mind-body approach and is now working in this area. I particularly have this interest and I guess like soft spot for pelvic pain because that was the start of my own journey. What I've really learned is pelvic pain is especially complex. And I think that is because there's this, unfortunately, this degree of shame that can come with it. It is a complex area of our body. There's a lot going on. It impacts our pleasure, our sexual relationships, the way that we feel about ourselves. And for me personally, I found it a lot easier to share about the fibromyalgia pain and the other symptoms I was dealing with over the pelvic pain. So it's a very interesting thing to look at. And I think the more we share about it, the less we are getting into that shame spiral that can happen with it. When I personally started opening up about my experience with Vuvlodynia, there were so many more people reaching out to me. And then I realized that there was such a lack of resources and direction for people that are actually trying to heal these chronic pelvic pain issues. So that is why we've got Rachel on. So welcome, Rachel. If you just want to take some time to introduce yourself and let people know what you do and what you're about.
Thank you so much. And thank you for sharing a part of your story. I really appreciate that. So my name is Rachel Gofman. I am a pelvic pain coach and doctor of physical therapy out of New York City. And I work with clients with a variety of pelvic pain conditions from Vuvlodynia to IC to PN to PGAD to vaginismus, really all of those diagnoses of exclusion for folks who have been to the doctor, who've tried to find answers, and who've been told, we don't really know why you have this. Here are your options of, pain management. So whether it's medications or injections or a whole slew of stuff that's often quite scary and quite expensive and only temporary. And so those folks who have kind of like done that and been like, that doesn't quite feel right for me. Those are the folks I end up working with. And that was really my own story, right? So I myself have been a patient like you. I also had my own pelvic pain. I had PGAD, Vuvlodynia, not PGAD, I'm sorry, Pudendal Neuralgia, Vuvlodynia, and IC. And really, my experience was I'd been to a million doctors, got all this testing done, and was told, we don't know what's wrong with you.
Oh, it's the most stressful thing. How hard is that?
It's so hard and it's so scary because so much of, Western medicine tells us like, if you have a problem, go to the doctor. They'll tell you what's wrong. You'll get medication. You'll feel better. Bing, bang, boom. And unfortunately, my experience and your experience in these conditions was that's not what happened. So it was so scary and so disheartening, and I really didn't know what to do. And so I was kind of forced in a way to expand my idea of how could I heal. Now, I have a history of other mind-body conditions, meaning conditions that were not being properly treated or really properly healed traditional models of the Western medical system. So I had chronic back pain a couple of years prior to pain. And I done all the right things, right? I got the scans. I was told I had a disc herniation. I was told I had L5S1. I had sciatica. I went to PT. I got cortisone injections, all the things. And then I really wasn't getting better. And that's when I had discovered the work of Dr. John Sarno. Are you familiar with his work?
Yeah, absolutely.
Yeah. So his book was called Healing Back Pain. And I read it. And I was at first like, wait, like what? But it also made perfect sense in a way because my pain had been triggered from a traumatic experience.
Just for the listeners, do you want to explain a little bit about, mind body medicine, Dr. Sarno? What are the main principles of that book? Because there's a lot there, but if you want to share a bit more.
There's so much there. I am not at this point a traditional like TMS Sarnoist. However, his work has been incredibly impactful in my life and it's a great jumping off point. So his real tenet is something called TMS, tension myositis syndrome. I mean, your muscles are tight. That's true, but it's actually a reaction to emotional suppression or repression. So the underlying mechanism that is causing the physical pain is actually emotional and not structural. You may have true pathological, quote unquote, pathological findings on MRI, such as disc herniations, disc bulges, stenosis, scoliosis, things that the doctor might say are wrong with your back. But actually, those are pretty normal structural findings, or what's called normal abnormalities, meaning if you scan everyone's spines, you can't tell by looking at the scans who has pain and who doesn't.
Yeah.
And that for me was incredibly paradigm shifting because I was under the impression that my spine was collapsing at the ripe age of 21. It was so helpful to understand that, like, hey, maybe my body's actually okay, but now what? Right?
It's just crazy how, I had that same experience with a book. I can't remember what book set me off, but I came across TMS and John Sarno's work actually after I had gotten well through brain retraining. However, it all made more sense. It kind of added to the understanding the mind-body connection. But it's just crazy how one resource or one success story can just blow your mind and then think, oh my God, how did I not come across this information sooner?
Totally. And when I found that book and I had healed my back pain with that, perspective, I still had a really hard time understanding that my pelvic pain could be the same type of thing. Because when I was reading and looking for, resources, everything I was reading about TMS or mind body pain was all about fibro, migraines, and back pain. And so I was like, could pelvic pain be the same thing? And I had an emotional trigger again when my pelvic pain started, but I just couldn't find the evidence I was looking for to tell me, oh, this is possible. So eventually what happened was I did find evidence. I found someone's success story on one podcast in one place. And she had healed, I believe it was PN. I think it was Pudendal Neuralgia is what she healed from. And I was like, okay, so this could be pelvic pain too. This could also be a mind-body thing. And that was enough for me to start trying, to start expanding my idea of what could be causing my pain. Because up until then, I was pretty convinced I had some kind of, an insidious thought of an embedded infection was kind of where my brain landed me on, which was a really tough place to be. Please.
I was going to say, well, that is very common if you've got pelvic pain to be going around because I had a similar thing. Like mine kind of started, to be honest, I'm still not sure what it was, but I think it was a UTI. I had one around that time. And, often there can be an onset of thrush, bacterial vaginosis, a UTI, and then sometimes not, but you do get caught up in that loop of there must be an infection. There must be something. And I think that's how pelvic pain can differ.
Absolutely. And the problem also is that there could be a new infection, right?
Absolutely.
Right? Is that, it's important to believe the results when you get the results. I have to say that, right? You have, a new onset of sensations, go to the doctor, get testing done. But if the tests are negative, then we can start to go back into more of the mind-body approach and saying, okay, I know this feels identical to an infection. However, we have ways of testing for that. And if those results are negative, let's kind of go back into that mind-body approach. One of the big challenges of pelvic pain, right? For back pain, you're not going to like grow a new tumor overnight, right?
Yeah.
But get a new infection. And that is something that I find my pelvic pain clients and I myself had also really struggled with throughout my healing journey. So it's a very, very real challenge with pelvic pain.
Yeah, definitely. So you kind of opened up to this idea of mind-body healing. You connected the dots between the back pain, the pelvic pain, which in itself is the first step. I truly believe the first step is just opening up to the conversation, actually searching for evidence and success stories of people that are on the same page. Because if we're in those groups on Facebook, if we're constantly around people who are struggling, which is so valid, but if we're not seeing any success, of course our beliefs are going to be fixated on finding a physical issue only.
Yes. And it's so normal, right? When you're first searching for answers to end up on those message boards, to be looking for some obscure structural cause. But you'll find as you read people's stories, they're just scary. People aren't really getting better. They're just trying more and more and more different types of physical treatments. And they're telling you stories of, lives, decades that were lost to trying to quote unquote fix their pain. I spent months doing that. Don't get me wrong. Like I spent months really going down the rabbit hole.
Yeah, it throws your body into a stress response as it is.
And it becomes a kind of like circular thing of like, feel a sensation, feel panic, look for solutions. And that solution looks like going on the internet and Googling or Redditing or whatever your forum is you're looking and seeking answers. And that can be an endless cycle. And if that's where somebody is right now, like no shame, no blame, we've all been there. And there is a recognition point of there has to be at some point where you're kind of done with that.
Yeah, absolutely. And I think that the people that do come out the other side or see improvements, they're not spending as much time on there anyway, because I know I personally wasn't. So I think it's actually remembering that even if there's nothing in front of you that looks like similar to your symptoms, a success story, it might just be that you're looking in the wrong direction. Simply that. So sorry, I do keep jumping on board because honestly, I could talk about this for hours. I know we've got a limit today, but back to the sort of opening up to the mind body conversation and approach to healing your pelvic pain. So with the TMS approach, I know that there's a few different things such as journal speak. There's different modalities that are used. So what particularly helped you, and how did your journey look?
Yeah. So I tried journal speak. I, honest to God, I'm not a journaler. I wish I was. I know so many folks really resonate with that work. And I love Nicole Sachs, who's like the official originator of journal speak. I think she's amazing. I hate journaling. So I did journal for a time, but I would say I did more voice memos.
Yeah. Nice.
Yeah.
Yeah, that's awesome. I'm like that too. I'm always thinking out loud, always processing out loud. So for people listening that don't know what journal speak is, I know I'm just throwing in some concepts here, but it's essentially, as far as I'm aware, it's about journaling some of your feelings, deep emotions, and then being able to process your emotions, having somewhere to an outlet, essentially.
And the important part of it is to be like brutally honest and not filtering yourself at all. So many of us who get a mind-body condition are really polite and really understanding and really don't want to be mean. And it is incredibly challenging to kind of unleash this voice that sounds like can I swear on here?
Yeah, go for it.
Right? Like a lot of that emotional expression is not kind. It's not filtered through a lens of understanding and compassion. It is sometimes vicious. It is sometimes totally like not quote unquote yourself, but that is within you and you're feeling those feelings, except you're not because you're repressing them. So this is an outlet and an avenue to allow you to do that.
100%. And I love how you said that you were doing, was it just voice notes to yourself?
Yeah.
That is so powerful. Having the outlet to express some of these feelings. And again, also identifying these feelings, I think is a huge thing for people moving through mind-body approaches, because you've kind of already jumped the gun a bit. I did want to talk on the whole people-pleasing, perfectionistic tendency that people can experience if they're stuck in chronic conditions, because at a nervous system level, it really is a lot of repression and a lot of going against our true authentic feelings, which is going to have consequences. For those of you who know my journey, I had a really traumatic event before my pelvic pain happened, which was the earthquakes here in Christchurch. I suppressed my true feelings, as I share on another podcast earlier. I really didn't have any space to feel the fear, to feel the sadness. And when I made that connection, yes, brain retraining was a lot of my healing, but also emotionally allowing myself to feel was huge for me.
Yes, absolutely. And I think also, again, talking about the trauma to mind-body connection, I think understanding the physiology of trauma and understanding kind of the fight, flight, freeze, fawn, and kind of what happens in your nervous system, what happens in your body during those types of experiences can be incredibly helpful and work for me. Are you familiar with the work of Peter Levine?
Yeah.
So I read his book. It's the less popular one, but it's called In an Unspoken Voice. And I remember reading that and just being so much kinder to myself. Because I had previously had so much self-blame for what I would consider, it was a freeze response. I had a freeze response in that I had wished I had acted differently. And I couldn't understand how I didn't act differently. I was so mad at myself for how I quote unquote acted or didn't act. Understanding the physiology of a freeze and what happens in a shutdown and how I didn't have access to mobilization, right? Whether vocally or physically. And really just that understanding was pivotal for me to help release some of that blame.
Absolutely. And I would love to do a podcast a bit further in depth about the different states in the nervous system. Freeze is particularly interesting. A lot of, like you're just speaking on, a lot of, I wish I could have done that differently. I have seen that time and time again. So yeah, Peter Levine, if you want to check out his books, he is a very good, knowledgeable person in that area too. Yeah. So you started expressing, and how did it look from there? Was it sort of an up and down journey?
There's kind of two parts of this. Part of it is the emotional piece and the emotional expression and the healing trauma piece and the understanding perfectionism from a new lens and kind of being kinder to myself and all that, and boundary work and all that. And there was also the sensation piece of reducing my terror of my sensations. And the two both, they had to happen, both of them. So honestly, for me, I think one of the biggest barriers for me was my fear of my pain.
Too.
And so a lot of my quote unquote work was in really understanding pain from a true neuroscience perspective, understanding how the brain generates pain 100% of the time, and understanding how this was being perpetuated in the chronic pain cycle and how to reduce my fear. And there's the logic and cognitive aspect, but then there's the experiential part. And I was really good at the reading and the learning and the understanding. The application I found a lot harder.
I really want to touch on and hone in on that fear piece, because a lot of the work I do with my clients is really getting them to understand the hypersensitivity that your nervous system and your brain go into when experiencing a chronic symptom, and being able to turn down that volume. And it's not about rejecting the pain. It's not about pushing it away. But it is actually reducing the fear and knowing, if we understand the pain science, it's not something that we need to fear like we do. And I think that fear is natural. It comes from not having the answers. It comes from being told we're going to be stuck with these conditions for life. But that fear physiologically is doing the same thing, and then sort of ramping up the nervous system, I should say, and then enhancing the pain.
Exactly. So beautifully said. 100%. And I think even with the understanding, I think it can be so hard, because if you believe, right, that pain equals tissue damage. And you've been told that your whole life. And you can learn, like you just learned, okay, that's not exactly what it means. We know that like pain is broader than that. It's not just in relation to damage. But if every doctor you've ever seen has only ever validated the belief that pain can only come from, right, a tissue issue, it can be very, very hard to self-validate all the time that my body is okay. My body is okay. My body is okay. When it doesn't feel okay, right?
Yeah.
And that's when I had to go into more somatic-based work. So basically my toolkit was a mishmash. So the framework was all, how do I create safety in my body and nervous, in my brain? That's like the framework, the guiding light. There are so many ways to do that. And my way is not the right way. Everybody gets to figure out their own toolkit. And I tell every client I have that. Like, I will give you a bunch of options. You play with it and see what feels good.
Yeah.
But really, I would get into these thought spirals that would just be unrelenting, where I would logically have this part of me that understood that I was okay. My body was on absolute high alert. Like, it just couldn't calm. The alarm was very loud. So I started to get into some more somatic work, which means body-based, more bottom-up techniques. So things like breathing exercises, vagal toning exercises, grounding techniques, ways of finding felt sense of safety that had nothing to do with my thoughts. Because I was that upregulated, I couldn't access the thoughts that I wanted to think. Because our thoughts are really an output, right, of our nervous system state. They're a reflection of our state.
80% of the communication comes from our body up to our brain. So we do need to include the body.
Exactly. And the body initially did not feel like a safe place to be. Only attention I would pay to my body was when it was in pain. So having little experiences of being safely in my body, that was a titrated process. I couldn't just go in and be like with the sensation. I had to first start with like outward, finding safety in the room I was in, doing the 5 senses, right? Really getting more out, and then to the outside of the body, and then to the inside of the body.
It's such a beautiful way of putting it. So often we try and jump in and go big from the beginning, and it's just not going to work. I've seen that a lot.
Yeah, but we want change now. We're all very impatient. That makes sense. We want to feel better now. We want to feel better 5 years ago, right? Like this is taking too long. But unfortunately, what I have learned, and many of my clients learn, is healing happens in slowness. Parasympathetic is slow. We cannot get to healing through fast and effort and trying and forcing. That does not work. And trust me, I've tried that part. Try to do it that way. It did not work.
Yeah. It's interesting because in the work I do, I see a lot of really, I'd say, quick change. But in saying that, it's not quick and then it's done. It's quick. You're continuing to use the tools. You have ups and downs. There might be a new realization that comes, symptoms might return, but it's really just about acceptance that this is a journey and small change, we need to build on that.
And I think it's so important to recognize, right, that the aim isn't to have no pain ever again. It's not to have chronic pain, right? But to think of yourself as like a failure if a couple times a year you have some symptoms for a couple of days. That's not helpful.
It's such a good point because so often people are like, so do you not have pain anymore? And I'm like, well, I'm not experiencing pain in this present moment. If pain came, I would have a toolbox of things. I would feel confident and more trusting in my body to get back on track. But I don't live with the fear of it, and I'm not experiencing it in chronic occurrence of it and in a place of fear.
Yeah. And I think that what really speaks to that is really that, or what you're saying is that real understanding of the pain isn't the problem, right? It's not the problem. And you don't need to be afraid of it if you understand why it's there. And it's just a messenger, right? It's just one way the body speaks and has learned to speak to you. And if you know how to listen, and if you know what to do in those times, it's not a problem.
Exactly.
But it takes a long time to get there. And it sounds like a lot of practice to get there, right?
It does. And it forces you to go inward. So that's actually kind of moves into that sort of next part I want to ask on is, you did some healing work. You were using different approaches. I'm sure, like all of us, it's been a bit of an up and down journey. You found what works. Looking back, what did having pain teach you, and what were your aha moments along the way? I know that's a loaded question. It's a big question.
My pain taught me so much. So for one, it told me, it sounds so silly saying it now because it feels very like, oh, didn't you know that before? But the answer is no. So that I'm allowed to prioritize my own needs, that I actually have needs that I can be aware of and tune into, and not just accommodate to whoever has the loudest voice in the room. That boundaries are something that I can set when and where I want to, that I can leave situations I feel unsafe in, that perfectionism and people pleasing have been adaptations that have kept me safe for a very long time, and that I didn't need to get rid of them to heal, but I had to change my relationship to them to heal.
Oh, every point you have just said is like bang on. Wisdom. When is anything working to your detriment versus out of keeping you safe?
So when it's a choice, right? So we have these like tendencies, right, of perfectionism, and I feel it coming up all the time, right? Anytime I write a post or I have a client session or I do a podcast, I'm like, I have the thoughts that come up. Oh, I could have done that better. I could have said that differently. I could have explained this better. And I hear that part of me. And I'm like, oh, you're just trying to keep me safe. You're just trying to make sure I'm seen in this way and loved in this way. And, and really just doing the best that I can. And that part of me has been online my whole life. Recognize that part and say, thank you so much. I'm actually okay. I'm a human being. And some things will go better than others. And how can I move forward? People pleasing, right? We can look at that part of us that's having that process and say, how do you think you're helping me right now? That lends to so much more compassion rather than trying to fight it and say, God, you're so mean to yourself all the time. Why can't you just like let it go and feel good about yourself? Like that used to be my dialogue before was to try to like beat down that part to go away.
Absolutely. And even with perfectionism and people pleasing, there's a positive intention, and it is that connection. So actually just acknowledging that and then coming from that place of choice. Do I really want to act on this, or is there another option? What is going to enhance my life?
Exactly. And like, right, what is the benefit? Exactly. What can I take from this? What can I choose to take from this? Or do I choose to not engage in this current dynamic and like let that go? But it's that choice point that I think has been really the pivotal part of every part of my healing process, has been finding where is the automatic and where is the space for choice. And that's true of responding or reacting to pain. That is true of setting boundaries or not setting boundaries, speaking up, not speaking up, choosing this activity versus this activity, right? Everything comes to a choice point and how I'm making that choice. And that used to all be externalized. That used to all be coming from, what do other people want me to do? Trying to guess and trying to like figure out, predict what others would be happier with me doing. And so much of healing has been going more internal from that and finding my internal compass and my internal knowing and saying, what do I want to do? What do I want to say? What do I want to think? And letting that be my guiding light.
It's almost like the pain. This is how I always think of it. The pain is there to wake us up. It's there to think for some people, you're so fixated on everything externally that you're missing your inner cues, your inner wisdom. And when we are forced to look within to resolve this pain, you can't come out as the same person. It's virtually impossible to look at where you have influence over your choices and how you can show up differently. You grow so much in the process. And I think any of my clients would agree. Sometimes you have to look back and you realize how much you've grown. Like you said, you would have been thinking differently. Sometimes I'm like, well, did I know that back then? But I actually didn't. I didn't know my patterns. I didn't know how often I was giving my power away, how often I had a lack of boundaries.
Absolutely. And really that space for agency and advocacy for yourself. And there isn't a single person I've seen who is healed through mind-body mind body approach, who hasn't come out of it saying, I feel more authentic, aligned, connected to myself. And I see it in them. They're a different person. And I know there's that phrase, like, I'm so grateful for my pain. I still don't say that. I still can't say I'm grateful for my pain.
Yeah.
Like, I wish I had gotten here a different way. But I think this may have been the only way I could have gotten here. It kind of forced me through in an expedited process to really do this work. Because it may not have been quote unquote bad enough for me to really look at it.
Yeah. And it's a huge mindset shift. You know, when I'd first heard the whole point of I, to a degree, can influence my pain, that used to piss me off. I was like, there's no way that this physical pain has anything to do with me. You know, I was in that mindset for years before I opened up to this conversation. So I can understand if people are sitting there thinking, how can you say that when I'm struggling so much? But I really just want to reassure people that, yeah, the mind-body healing journey will teach you things that sometimes you're forced to learn, but you do, from my experience and from watching other people go through their journey, you come out as a more authentic, aligned version of yourself.
Mm-hmm. Exactly. And I have to also validate what you said, which is that it can feel incredibly invalidating when you first hear that, you know, your brain creates your pain. And I certainly felt that way. And I just want to also say that doesn't mean that pain is your fault. This is not a conscious process. You are not choosing to create pain. No one chooses to create pain.
No one would want that. Trust me.
Right? And so if anybody's feeling invalidated, I just want to say that's totally normal. And I just want to offer that I think what helps is actually looking into some of the pain science and understanding the pain neuroscience and how this works from like a truly scientific perspective. And then perhaps looking at this as an opportunity to actually have some agency to create change rather than feeling totally reliant on physicians who don't understand this in the same way.
Just acknowledging that physicians have limited time. The health system is burdened. It's no one's fault that this is the way it is, but where can we take some personal responsibility just by educating ourselves and just looking at different perspectives? That is the starting point. And it took someone, a physiotherapist actually, someone who worked physically with pain, to explain the science behind pain in the brain until I believed them, because I was like, this is someone who works physically with the body, so they must know what they're talking about. But there is a lot more out there now, and I think just, like Rachel said, acknowledging nothing is your fault. This is just a process that's occurring, but looking at where we can expand our education around pain.
Yeah, our perspective, and then perhaps open up more avenues for treatment. If you've already tried the just regular physio and you just tried these medications and you're not really seeing change or results or feeling more scared and more worried, there are other avenues to explore that are totally real and valid and scientific and not blaming you for your pain. That's important to say.
And as a physical therapist, you know, I guess merging and how do you find the connection between physical therapy and the mind-body connection? Because as we know, this is all real, it's all science, but I think there are some barriers to what the current health system is kind of putting out there.
Certainly a challenge. So when I am in the clinic, I'm not in my own practice, I work for somebody else. So the clients or the patients that I get in the clinic, they tend to come to me not mind-body informed. They come to me from their physicians who told them they have pelvic floor dysfunction or some, diagnosis of you have a body problem. And so the way that I think about PT and the way that I think about how I do PT is to create a felt sense of safety in the body. And there's so many ways of doing that. Now, I often don't open up my first session saying pain is from the brain and giving that feel, because most patients aren't coming to physical therapy expecting any kind of discussion about their brain or any psychology.
Yeah,
And
absolutely.
I learned this the hard way. That is a really good way of turning some people off.
Yeah.
I understand that completely. So really what I do is first I get their full story. I look for patterns of how symptoms started, patterns of their history. And in our time together over the course of, several weeks, I have to give some nuggets of pain science education. And I see how they land. Some folks are like, oh, interesting, tell me more. Can I get more resources? And I'm happy to send resources, podcasts, books, all the things. Some folks are like, just massage my back. So listen, would I much rather be able to get into the nitty gritty and the pain science and give the spiel to everybody 1,000%. But as you mentioned before, right, there is a readiness for change that folks need to be at to even receive this information. And I completely respect where people are in their journeys. And so many folks are just not in the place to hear this perspective and implement this knowledge. And that is okay. And I used to think it was my job to save everybody. I do not think that.
Me too. We learned the hard way.
I do not think that anymore. What I love is get on board and do this work and feel better. Yes. And I have to respect the autonomy and agency of everybody in front of me. So if I can't get into all of that, what I will do is help normalize what they're experiencing, help reduce fear of their tissues, parts of the body, helping them connect to parts of their body they may have been afraid of, helping them get back to movement, helping them feel more confident in movement. All of these ways of creating a felt sense of safety, but kind of like through the back door.
You said safety earlier, and that is the premise of mind body healing. Safety in the mind, safety in the body, safety with yourself. Doesn't matter what way we are approaching it, it's still putting that nervous system into the same state. So I love that.
And that's why I say so many things work. As long as it's going along that kind of framework of creating authentic safety, not just telling yourself I'm safe when you don't feel safe and you're not safe from, people pleasing and perfectionism and not really accounting for yourself and all of these things, but creating authentic safety. And that can be done physically and emotionally and through all these mind body modalities. There's so many ways to do that. And that's what I really encourage people to explore.
Thank you so much for sharing. I resonate so much, and I'm sure everyone listening can see that as well. Whatever they choose to do, whatever feels like it resonates for them. And finding people as well, that's another thing I just want to touch on. Actually finding people that you resonate with and remembering that there are different people out there doing different work that have a different approach. And that even goes for medical practitioners. If you don't resonate with someone, if you don't resonate with their tone, the way they deliver information, what they're saying about your health, remember that there are other alternatives.
Yes.
Keep looking.
Keep looking. And you working with somebody who you feel safe with is maybe the most important part of that whole process. It's so important that whatever clinician or practitioner or coach or whoever you work with, that you feel like they understand you, they speak your language, they believe that you can heal. Those are all really important things to look for in whoever you choose to work with.
Absolutely. So a few questions as we wrap it up a little bit. Any favorite client stories that you have? Is there anything that sticks out in particular? I'm sure you've seen it all. And it's very rewarding work, the work we do. So, we kind of get used to hearing good feedback.
I'm always so blown away by the things my clients do. So one of my favorite stories is I had a client who, when she came to me, had PGAD, which if anybody doesn't know what that is, it's basically general arousal disorder. So it's like this persistent sensation of constant arousal, which can be very painful, uncomfortable, scary. And she was a couple years postpartum. And the way she thought about it was a birth injury, which is very scary. She'd been to every pain specialist. She had this diagnosis. It was terrible. And at the time I met her, she was working part-time. She went down from full-time work because of the pain. She couldn't be alone with her child because she couldn't lift the child, couldn't really take care of them on her own. And by the time we stopped working together, she was back to full-time work, was throwing her child like into the pool, carrying them, like super physical, went back to running, like went back to doing anything that she wanted. And seeing somebody go from being terrified of doing everything, which makes perfect sense, given the diagnosis and kind of the prognosis she was given, which was like, you're going to injure the nerves. And it was a lot of fear, so much fear. So really seeing her step into her life and go back to doing everything she wanted to do in full force was incredibly beautiful. And then I had a client also who had PN, who when I first met her, he was sitting on ice packs all day. She really couldn't do very much, which is a very common story, unfortunately.
Yeah.
And just this past year, she's gone to like 2 almost back-to-back international trips, like traveling all over the place, like sitting on crazy benches and like buses and had like no pain, almost no pain during her travels. And I was like, wow, like how incredible. How incredible.
Because what I know about PN, or what they say about PN, very much a nerve issue. And again, it comes back to their fear around this must be something that is impossible to feel pain-free from. So that's incredible. And I ask you because, there might be someone listening that actually is in that position. And these stories of healing, they just give us that confidence.
I think the stories are so important. I often say, I really, really thought I would never, ever share my story.
Same.
When I was going through my pain, I was like, no one will ever know. This is so embarrassing, so shameful. I had so much just like real shame and fear. And I think about it now, and I laugh all the time. So I'm like, I talk about this all day, every day.
Yeah.
But sorry,
go for it.
Because I think it really helps people.
Yeah, it does. Like on that point, because I noticed on your website, when you're working with your clients, you get them to reconnect to pleasure. And this is actually one question I'm just thinking of on the spot now. I find that fascinating, and I've found that also to be very true in my life, because looking back now, and it was a while ago that I did experience pain, but beyond just getting rid of the pain, it was really retraining myself to connect to my body and to connect to pleasure again. So have you got anything to share on that one?
So I'm going to start with first, honestly, pleasure not related to the pelvis, which is just connecting to sensory pleasure, feeling anything that feels good. There's often so much fear around the pelvis and pelvic touch and anything related to like pleasure in the pelvis. So I like to start again more outside and work in.
Yeah.
And starting with finding some like a warm fuzzy blanket and like really connecting to like, how does that feel? What does it feel like to feel that sensation in your own body? Is there warmth in your chest? Is there like a softening? Like really connecting to what does it feel like to feel good? And it's also really important to say that pleasure is a master regulator of your nervous system. It automatically puts you out of that fear and fight or flight and into that more safe and secure rest and digest. So it is such a beautiful way in that like literally feels good.
Yeah.
And helps to retrain your focus onto things that feel good. When it comes to more like sexual pleasure, I first have to say that education is really important. Something I often start my clients with is helping them to understand female pleasure, how it works. And so often they feel deficient because they think like, oh, I should be able to just have like, this is for people who are having penis and vagina sex, but just be able to have just like penetration with no warm up. And like, they think that they're, deficient because they're not able to do that. And really educating about how long it takes for women to get aroused, what that looks like and feels like, what is normal, right? And how to also advocate for their needs with a partner.
Absolutely.
So,
have you read the book Come As You Are?
Oh, yeah, that's a classic.
Yeah. Just for people listening, that's a good place to start.
It's a great place to start. That's a really good one. Really just for a broad overview of female pleasure. And both from like an anatomical and also from like a relational perspective.
Yeah, absolutely.
Absolutely. But pleasure is a big topic I'm happy to talk about forever. And I think it's something that people who are trying to heal pain often neglect. because it doesn't feel quote unquote productive. And I argue that it's one of the most productive things you can do is to actually explore pleasure.
Absolutely. And like Rachel said, exploring pleasure day to day. What makes you feel good? Because living with pain or any chronic condition, you lose sight of what feels good because your body is in a stress response. You're on survival mode a lot of the time. So I think it's a beautiful conversation. Maybe we get you on for a whole podcast for pleasure itself.
Absolutely. I'd be happy to do that.
Awesome. Okay. So final question.
Yeah.
What message do you have for those who may be in the position that we were in when we were struggling with chronic pain? Any wisdom you would share to those people that are just feeling stuck and in the depths of it?
So the first thing I'll say is that you are not alone. I think so many of us feel really alone in this place because no one talks about pelvic pain because you think that like nobody else has it. You're not alone. And there is so much hope for healing outside of what Western medical doctors may have told you. And there's so much space to explore that. And there are people who can help you do that. You don't have to do it alone. And that's something I wish that I knew when I was going through this. I couldn't quite find people who specialized in this. But there are folks like Bianca, like myself, who can help. Mm-hmm. And you don't have to do this alone. And it's for sure always possible to feel better than you currently do.
Yes, thank you so much. I 100% also agree with that message. And I think that is why I do what I do. And I'm sure it's why you do what you do. I remember so clearly sitting in, I think it was like a nutritionist office, and I was just bawling my eyes out. And I remember her saying to me, "What will you do if you get rid of this pain?" I just remember saying, "Oh, I'm going to make sure no one has to go through this." Like, obviously, I can't heal the world, but I'm going to make sure no one has to go through it alone, because 10 years ago, it was even less talked about, and there was no one to guide me through this process. So you are not alone, and I know how hard it can be. Absolutely. So thank you so much, Rachel, for coming on. Where can people find you, and have you got any offerings that you would love to share about?
Well, thanks so much for having me. So yeah, you can find me on Instagram. I'm at the Pelvic Pain Coach. That's one word. And also my website is thepelvicpaincoach.com. I currently work with clients one-on-one. And you can just either DM me on Instagram or email me through the website, and we can kind of set up a little consultation call.
Awesome. Thank you so much, Rachel.
Thank you.